Today we're going to talk about how to clean ears on our pets. We're going to begin with a little bit of anatomy. That's the canal, the ear canal on cats and dogs are pretty similar, and they're very different than us, where our canal is straight in, where their canal goes down and in. So a lot of times owners are worried about damaging the drum when they clean ears. It's actually very difficult to cause any damage to the drum just from the way it's positioned. You basically have to go down and in toward the head, and it's more difficult than it appears. So I'll explain on the graph how we're going to proceed, and then we'll show on a little demonstration with a real dog to how to do it. So you basically prepare yourself ahead of time with what you need: your cleaner, your swabs, your Scott towels, your Kleenex, whatever you're comfortable working with. And then you open up the ear with one end, and you take your liquid and you pour it in the canal until it fills up to the top. So you'll basically see the overflow of the liquid. Once you see that, you have to move quick because the dog is going to want to shake. It's a reflex, it's normal. And you're going to grab the cartilage, the thicker part of the ear, and shake that, with firmity, until you hear a little washing machine sound. To allow good cleaning of the canal. Once you've done that for a short time, you want to back up because there's going to be a reflex of shaking that is going to splatter all around, and so you try to stand back, and after that you'll be ready to dry up the canal with your Scott towel, your swab. Just remove the excess fluid that's in the canal that was poured into. So we're going to go with the patient and see how it's done in the real life. So we're going to be cleaning Mimi's ears, and as you can tell, I'm holding the ear pinna with a firm hand, and with my other hand I open up the canal by pushing the hair out of the way. Now we're going to be pouring the liquid into the canal, and you see it coming to the top, so that means it's enough. And then we grab it rapidly and shake the ear to hear that noise I was telling you about earlier. And we're going to do this for maybe a minute. Good. So there's the point where you want to stand back when you let go. All right, so we're now at the time where we want to, remove the excess fluid. As you see, I was prepared because she's small with a little rolled up Scott towel to kind of push in the canal to help absorb the excess water. So I shake it up a little bit, so that removes the excess, which is pretty clear because she has no issues, no problem with infection. And then I go with my finger that doesn't go very far to remove the excess that might have come on top. It's still a little bit wet, so there was still a little bit left in there. Now, I have a Q-tip here, but it's not something I recommend using on all cases. The Q-tips, you don't want to push down the canal because you may actually push the debris further in and cause a plug that would be further difficult to remove. Now, with the Q-tip, though, you can go in between the little folds if you still see dirt after you're cleaning to remove the debris that might have come to the surface or might be caught in between the little fold of the ears. So that's it.